Good morning, my name is David Matlock. I am a flight nurse with Apollo Med Flight, and I'm here to talk to you about the challenges and hopefully some solutions of rural healthcare. I'm going to go over the statistics of rural healthcare, some of the barriers to performing, especially primary care within the rural setting, as well as some social determinants of rural individuals. Then I'm going to go over some innovations and solutions and some policy and advocacy that's going on right now. So my primary service area that I see in working with Apollo as a flight nurse is I fly in the majority of Kansas, eastern Colorado and New Mexico, and the Texas and Oklahoma panhandles, a little up into Nebraska. And the vast majority of patients, I'd say 99% of the patients that I see, are either rural Americans being transferred from a rural hospital to a metropolitan hospital, or from an accident or situation such as that to a more metropolitan hospital. More than 60 million Americans live in a rural setting. That makes up over 1/5 of the U.S. population. This population is also beginning to age pretty rapidly. A vast majority of them are baby boomers, creating this high concentration of chronic disease within the rural communities just because they're getting older, they're aging. And the older we get, the more chronic disease we have. All of these statistics, by the way, are from the Government Accountability Office. They've got an excellent website. It's really interesting. You should go check it out. Some of the barriers to, especially primary care and just rural healthcare in general. So they've had a lot of facility closures. From 2013 to 2020, more than 4% of rural hospitals and clinics have closed. That's again per the Government Accountability Office. Many of these are just small town hospitals, small town clinics that allowed for people to receive care directly in their hometown. This has caused rural Americans to have to travel between towns for basic medical care. Oftentimes 5 times farther for primary care and greater than 50 miles for specialty care. This has been evident in my practice. I see many Americans, many of my patients drive from their town to a slightly larger town to get some medical care and then be flown to an even bigger town. So that's delaying vital care that could take place even sooner. This is an issue because in stroke or in heart attacks, stuff like that, time is of the essence, and taking 20 minutes to drive to the next town, 30, 45 minutes to drive to the next town can be very detrimental. In addition, many rural Americans can't afford to take that time off to drive to get something that might be benign checked out, but might be something serious like a heart attack or a stroke. Some of the social determinants, many rural Americans have high school diploma or less education, limiting their literacy and sometimes limiting their literacy and especially limiting their health literacy. This may prevent them from even going to doctor's appointments or seeking anything else, thinking that they don't want to expose that lack of literacy. Rural Americans also have a lower median household income compared to urban Americans, limiting medication adherence and oftentimes insurance availability. Many lower income jobs lack insurance availability, and the healthcare marketplace can often be more expensive than it's worth. Many rural, especially in the deep rural areas that are away from towns, that are individual homesteads and stuff like that, they have limited access to reliable technologies such as internet, and this can limit appointment adherence and stuff like that. Thankfully, cell phone and telephone lines have pretty much reached everywhere at this point. So That's one benefit and one method that they can use to kind of connect with their doctors. Some innovations and solutions for these problems: telehealth and remote monitoring using smartphone EKGs or home BP cuffs, and blood glucose monitoring, like those continuous blood glucose monitors for the diabetics, or just the blood pressure cuffs that will allow you to keep a log of blood pressure. Even those smartphone EKG devices that you can put your thumbs on and it'll tell you if you're having a heart attack or AFib or something along those lines. All of these things can help aid in that telehealth, because they're some vital signs that you can even transmit to your doctor, to your telehealth provider, and they can evaluate those from another city oftentimes. Another thing is retail health clinics and nurse-run microclinics. These are excellent resources for primary care, the day-to-day management of chronic symptoms or management of diabetes or gout or something along those lines. These are excellent resources for this and can expand into these smaller communities easily. Also, expanding the practice of nurse practitioners. Many states, especially Kansas and Texas, that I fly into, have a very limited nurse practitioner scope. Many of them require a doctor to preside over them. Expanding that practice to allow for nurse practitioners to practice to the full extent of their education would be huge for the rural community. Some policy and advocacy that's going on. There are ongoing campaigns for nurse practitioner to expand their practice. And I know that there's legislation in Kansas, especially right now, to help expand Kansas to a full capability, a full practice state. That will allow these nurse practitioners to move into small towns, set up shops, or set up clinics, and become primary care for these rural Americans much closer than they previously had it. There's also some grants and support for rural retail and nurse-led clinics that are available. There's not much, but they are available. They are out there. The USDA and FCC have also increased initiatives to close the digital divide with a broadband expansion, allowing for increased connectivity for those rural Americans, potentially increasing the availability of telehealth and such like that. In conclusion, the demographics barriers and social determinants present problems for rural healthcare, but online healthcare, increasing mid-level participation, and setting up those retail clinics can really help ease these problems. Something that we can do is we can engage our legislator and community leaders to increase and we can voting to increase the nurse practitioner accountability and practice. Letting our legislator know that there needs to be more telehealth or telecommunication infrastructure, as well as letting them know that there needs to be more money fed into these grants, allowing for closer primary care for these rural individuals. In the meantime, we can engage in the available telehealth resources, what is available out there. Every day those resources are expanding, and every day cellular networks are expanding, allowing for more connectivity for rural Americans. In addition to stressing to maintain our patients' medication adherence, there are new programs like Amazon or other pharmacies will ship medications to them, allowing for that for them to not have to travel those great distances to a pharmacy or to a bigger city or a hospital. Something else that we can encourage they do is group their doctor's appointments. If they need to see 2 specialists in a primary care, rather than doing that once a week or month, we can group that all into a couple of days. They can go have their doctor's appointments taken care of, come back, not have to worry about it for a while. This allows a lot less travel. If you have any questions, feel free to email me at damatlock, that's DAMATLOCK, at buffs.wtamu.edu. And thanks for listening.